Hello guys, I'm Dr. Alan. I will start with the forehead treatment using Ellanse with the fine injection techniques to smooth out any uneven areas. Let's cleaning the model's entire face with iodine. First, we will make an entry point at the superior temporal crest, and then switch to a cannula for retrograde injection. While inserting the cannula, make sure to rotate the syringe gently to avoid aggressive injection. Each injection should be no more than 0.1 ml. For areas with 1.5 cm above the eyebrow, I recommend a superficial injection in the subcutaneous fat layer to avoid the supratrochlear artery and supraorbital artery, because in this area they run pretty deep. As we retrograde the cannula back, make sure the Ellanse is evenly spread along each line. You can also use your finger to feel where the tip of the needle is. Add a little volume just above the bronze to create a nice, natural transition from the forehead to the eyebrow. Now let's insert from another entry point to smooth out the outer part of the forehead. For areas beyond 1.5 cm above the eyebrow, a deeper injection right above the periosteum is better since the blood vessels are closer to the skin here. The key throughout is to avoid blood vessels and ensure safe injections. Again, use your fingertip to feel the movement of the cannula to make sure the injections is nice and even. A fan-shaped retrograde injection to refill in many unevenness on her forehead, but don't use too much product since our model is quite thin and the concavity isn't pronounced. Alright, the injection on this side of the forehead is done. Next, we will focus on treating the holing in the temples. The temple area is a relatively large treatment zone, and there are 3 layers you can inject in this area. First, move up 1 cm along the temple crest, then go lateral 1 cm to locate the swift point. This is the 1 up, 1 over technique by Professor Arthur Swift. Here, we will use a needle to inject on the periosteum with aspiration, no more than 0.2 ml per injection. Just give it a little massage to spread the filler evenly. Then we will do another periosteal injection a little bit to the side. Don't forget to aspirate. Make sure not to exceed 0.2 ml at each injection point. The injection can help lift the lateral corners of the eyes and reduce cross-fade. The second method is the interfacial layer injection. Along the hairline, the temporal region is divided into the anterior temporal region and the posterior temporal region. In the anterior temporal area, we will do an interfacial layer injection. Find the superficial temporal fascia by picking up superficial tissues with 2 fingers. We start by making an entry point with a needle at the lateral edge of tooth. Then use 23-gauge cannula and inject between the deep temporal fascia and the superficial temporal fascia. Here, 2 hands coordination is really important. Use your other hand to pinch up, which help guide the cannula tip to move axially along the interfascial layer. This layer is smooth and safe for injection, which helps prevent post-operative unevenness or small nodules, especially for patients with thin skin like Caucasians, who are more likely to have these issues when injecting Ellanse in the superficial subcutaneous layer. Fill in Ellanse evenly and keep each injection line to no more than 0.1 ml. The last one is the superficial injection in the posterior temporal region, making an entry point 1.5 cm in front of the triggers. Use a 23-gauge cannula to perform a fan-shaped retrograde injection in the subcutaneous fat layer. The benefits of this approach: first, it provides a more noticeable lifting effect. Second, since the superficial temporal artery lays within the superficial temporal fascia, this layer is very safe, reducing the risk of embolism and preventing hair loss. Next, I will finish up the injections on the left face, using the same techniques and amounts as on the right side. Post-procedure care is key to optimizing patient outcomes. For the first 24 hours, make sure to keep your face clean and skip the makeup. Avoid too much sun, UV lamps, and really cold weather until the swelling and redness go down. Avoid swimming or take a bath on the first day and refrain from drinking alcohol for up to 72 hours. You can use ice packs to help with swelling and bruising, and don't forget to avoid laser treatments, chemical peeling, or any other procedure that trigger an Subscribe to my channel and join me in shaping the future of beauty with painless rejuvenation.